A hip replacement operation is a procedure that replaces both the ball and the socket of the hip. Pretend like these plastic pieces are showing half of the pelvis bone and half of the femur bone, and they're covered over with muscle and skin. When we get into the hip joint, the first thing we would do is get into the socket, and we would shape out the socket with a tool. Once we did that, we would place a new socket. It's made of titanium. It has a roughened surface on it so that your bone can grow right into this part. And we put that right into the pelvis bone. Usually we'll use some screws to help secure it in place. There's also a plastic liner that is inside the socket. It's made of an excellent material that is very resistant to wear and to oxidation. That's what we do on the socket. To replace the ball, we have to be able to anchor the ball to the femur bone somehow. Now this is pink because it's made of ceramic, and what we'll do to anchor it to the bone is we use a stem. Here's a stem for a total hip replacement. We shape out the inside of the femur bone, and we place the stem right down into the femur. It wedges tightly. People don't hurt from that, and it fits snugly so that they're able to bear weight immediately. We put the right sized head ball on the top of the stem, and by the time everything patches back together, now the hip is able to move very smoothly without the bone-on-bone pain of arthritis.